Welcome back to 5 on Fridays. My name is Brandon Kimbrough. Really excited for another episode. We're talking all things dental today. I'm very lucky and grateful to be joined by Dr. Johnston. How are you today, sir?
I'm doing great, Brandon. How are you?
I'm doing great. And what is your role at Delta Dental?
I serve as the Senior Vice President and Chief Science Officer for Professional Services.
Awesome. So we've got a top dog. I'm super excited to speak to you, our expert, our resident expert, joining us today. All right, let's dive straight in. Why are dental visits so important?
Dental visits are hugely important. As you know, the mouth is connected to the rest of the body. For years, dentistry has always been treated outside the body, but now a lot of recent evidence just in the last 20 years has shown that things that happen in the mouth can affect the body, and then things that happen in the body actually affect the mouth as well. So, it's no different than taking care of your left arm. It's all connected.
Yep. No, that makes total sense. And how many would you guys suggest we get done in a year? Just one? More than one? What's sort of the school of thought around how many visits can I do in a year?
Well, traditionally, the American Dental Association has always recommended twice-a-year cleanings, and that was really never founded on any scientific evidence. It all goes back to a social contract between, I think, the Pepsodent toothpaste company and the American Dental Association. It was brush 2 times a day with Pepsodent and see your dentist twice a year. And that has actually served us pretty well over the years to help prevent decay and gum disease. But now the thinking's changed a little bit. Instead of just 2 times a year visits, we actually look at risk assessment on the patient. So if you're a patient that, for example, has had decay, had gum problems, have immune problems, if you're a smoker, if you're pregnant, if you have these types of considerations, 2 times a year works pretty well. But if you have other things that are going to cause you more problems, you may need to be seen more than twice a year. For example, I'm a periodontist by training, so we see our patients 4 times a year because some patients can't resist the bacteria that's in their mouth from destroying the gum and bone. So we have to get that off of there even more frequently. So what I would ask your dentist, based upon your history, your medical history, your dental history, to do a risk assessment and have your dentist decide how often you need to be seen to keep you out of dental problems.
Okay, that makes a lot of sense. Yeah, you're going to base it on how severe the problem is in your mouth. I mean, it's funny, you mentioned that that's sort of like something that came up over the time. We just thought it was 2 times a year, basically almost based on advertising. But in reality, for some people, it could be more frequent than that.
That's correct.
Okay, good to know. All right, so let's dive into the family a little bit. What about young children? Let's say maybe 0 to 5. How often should they go to the dentist?
Well, again, I think the first dental visit should always occur before the age of 1 or immediately after the eruption of the first tooth, the lower front tooth. It's important because the age 1 dental visit has been shown to decrease the amount of problems that kids have over the years, mainly because the age 1 dental visit is more for the parent than for the kid. You can get the kid used to fingers in the mouth, the strange noises and sounds, and the lights in the dental office, so they're not afraid later on, so we can have less anxiety and more compliance with dental care in the future. But also for the parent, because it gives us an opportunity to teach the parent how to take care of their kids' teeth, teaches the parents good diet habits, so we don't have sugary, sweetened foods or fruit juices that actually promote dental decay. So it's good for the parent and good for the child. There's also a way we can look at what's called anticipatory guidance by looking at how the teeth are erupting, if there's going to be any problems that we can help prevent before they become problems.
Okay. Yeah, no, that's really good to know. Before we had a conversation offline before recording, I have a 5-month-old, so I'm locked in. I'm really interested in everything about that section. Can the child go to the parent's provider, or should we seek out a pediatric dentist's something else?
Well, that depends. I think for most kids, a general dentist does fine as long as consult with your family dentist, see if he's comfortable taking care of kids, because it does take some special training to do an age 1 dental visit. It's not routinely done in a dental chair. We have what's called a knee-to-knee exam. You put the kid on a pillow in the knee of the parent, and the dentist can look. We try to keep it as unscary as possible. But if the child is anxious or afraid, it might be better seeing a pediatric dentist. It's a whole specialty in dentistry, and they're trained to deal with anxiety. They have better ways of looking at children and keeping the stress low. Or if your child already has a lot of dental problems or is going to have a lot of dental needs, sometimes it's better to sedate the child in a hospital environment. It's much safer. You have less anxiety, and you don't set up that white coat syndrome in the future. Also, if your child has complex orthodontic problems, they can do interceptive ortho, utilizing their growth to help prevent future bigger orthodontic problems. So I think it's up to the child, and it's up to your family dentist if they're comfortable taking care of the child.
Okay. Yeah, that's really good to know. Like I said, personally, I'm excited for that answer, and I appreciate that context. I'm sure our viewers and our listeners will appreciate that too. Okay, switching gears a little bit. What are your thoughts on adult orthodontia, especially via mail order?
Well, adult ortho is valuable. It's been shown that if you can straighten the teeth and have good dental facial balance, you tend to get less decay, tend to get less cause gum disease. So it can actually be I know it sounds kind of counterintuitive, but straightening out the teeth could actually be a preventative measure for future dental problems. As far as mail order dentistry, they don't usually really use the term mail order dentistry. It's the preferred term now is direct to consumer. There's been a lot of litigation, a lot of lawsuits just over using those terms, so we use direct to consumer. You have to look at these things. It's not a mode of therapy. They're basically using clear aligners, which are used by dentists and orthodontists all the time. There's nothing wrong with that. The key problem is that when you go direct to consumer, you don't have the advantage of a dentist actually diagnosing the problem. You don't have a dentist finding out if there's going to be complications. For example, if you have existing gum disease and you use a direct to consumer model, that can actually make the gum disease worse. But what if you have an implant? Since no x-rays are utilized, what if you have an implant? You can't move an implant. And you can't do a comprehensive case with direct to consumer aligners because you can't get those final movements done, fine-tuned down like an orthodontist or a dentist can do. You don't have the opportunity to do what's called interproximal stripping, in other words, to make space for the crowding. You don't have the advantage of using buttons to actually refine little things that you put on the teeth to allow the aligners to do the job. So, we can't condemn direct to consumer all the way because the aligners are used by dentists. But doing orthodontics without the supervision of the dentist, well, first of all, it's illegal. You could practice in dentistry without a license, and you can get into a lot of complications. And we've seen the complications here at Delta Dental with patients that have tried to use this without having the dentist. They could actually make things worse.
That's really good to know. I know, especially, it's this very similar conversation that we're having, I think, in the vision space also, where people are seeking out certain online retailers and maybe not having such a strong relationship with their provider. That's really good to know, especially for people in the space where they're maybe looking for those aligners. Okay, I appreciate that. That's good perspective. Go ahead.
Dentistry is not a skilled trade. There's a reason why we spend 8 years going to dental school.
Yeah, right. Exactly. Some expertise in it, and it's important to have, an expert take a look at you, right? Okay, this one's a bit of a myth buster. How important is flossing really?
You should only floss the teeth that you actually want to keep.
Okay. I like that. So unless you don't want them, go ahead, leave them. Yeah. Don't worry about them.
If we just look at it practically, a tooth has 5 sides to it. It's got a front, a back, a tongue side, the cheek side, and a biting surface. Toothbrushing does a really good job on the biting surfaces, does a great job on the cheek side and the tongue side, but you're not cleaning in between the teeth with a toothbrush. Think about washing your hands. Would you wash your hands but not clean in between your fingers?
That's a really good way to describe it. I hadn't really thought of it that way, but that makes a lot of sense.
Yeah. I think maybe about 10 years ago, there were some studies that were taken out of context that showed that flossing didn't affect tooth decay and all that. Remember, we floss our teeth not for decay purposes. We floss our teeth to prevent gum disease, right? Cavities we watch our diet, our sugar intakes for cavities. But while flossing may not affect cavities that much, it certainly does affect gum disease, gingivitis, and gum disease. So yes, it's very important. You need to be flossing. Floss before you brush, because whenever you're flossing, if you're moving any of that plaque to the outside or inside of the tooth, that'll allow your toothbrush to remove that easily.
Yeah, no, that's really great. I thought we were all going to get away with not flossing, but you cleared it up for us, Doc.
Nice try, Brandon.
All right, if there was one thing you could share with city employees, what would it be?
Ironically enough, all dental disease is preventable, inexpensively preventable. Good brushing and flossing, regular cleanings, wearing a mouth guard when you're playing sports, you can prevent all these. And not smoking, not drinking to excess. All these things are preventable. Unfortunately, in the United States, we have about 60% of the people with dental insurance, but only 40% of the people actually use their dental insurance. So we have to just take our time. We take our time washing our hair. We take our time, doing other hygiene things. We need to take just a few minutes a day, every day, to do good oral hygiene and see your professionals regularly, because dentistry is a lot easier if you're preventing, and it's a lot easier if you're treating small problems. If you let them go to big problems, that's where dentistry starts to get its bad name. So utilize your dental benefits. Take care of your teeth, and they'll take care of you.
I appreciate that. That's great perspective and the perfect sort of tone to leave us on as we close this one out. Dr. Johnston, thank you so much for your time today. We really appreciate it, your expertise. Everyone can find more information about Delta Dental in the description of this video, as well as on the Employee Benefits and Wellness websites. You can interact with deltadental.com, get the app, find a provider, find out more information about what's covered and what's not on your benefit. All of those wonderful things and more. We can link you up if you're having issues finding anything. Dr. Johnston, one more time, thank you so much for your time today. We really appreciate it.
That was my pleasure, Brandon. Thank you.
Yep. Take care.
Bye-bye now.